Hi, my name is Katie Mahoney. I'm the Director of Healthcare Regulations here at the U.S. Chamber of Commerce, and I'll be answering your free enterprise questions this week. We received 3 questions, and I hope to answer all 3 of them in a more collective and responsive way. But to outline the 3 questions, they are: have we missed our last chance to repeal the healthcare law? Short answer, maybe. What is the Chamber doing to mitigate the damage of the new healthcare law? Short answer, quite a bit. And how long will it be until Obamacare goes into action? Can parts of it be repealed or at least improved between now and then? Short answer, definitely. To answer all 3 questions, hopefully more fully and comprehensively, I'd like to talk a little bit about our efforts at the Chamber here on healthcare, more broadly, and healthcare reform specifically. We've been very engaged on healthcare reform and how to combat the bill that we opposed and the law that we supported repeal of. We've been working on 3 tracks to deal with the health reform law now that it's 18 months nearly post-enactment. First, on the legislative side with the members of Congress, we've been working to repeal provisions that are particularly onerous. We saw success earlier this spring with the repeal of the 1099 provision, and we continue to work to repeal some of the more onerous burdens on employers, our number 1 priority being repealing the employer mandate. There are 2 bills, one in the House and one in the Senate, that are exclusively devoted to repealing the employer mandate, H.R. 1744 and S20, and we've seen a lot of traction in the House on that effort, and continue to work on that effort in the Senate. As far as whether the law will be repealed, I think it's fair to say that it won't be repealed with the current president in office. I can't imagine him allowing a bill, even if it is passed in the Senate, to go through past his desk without a veto. We are working on the regulatory piece to ameliorate all of the burdens that are contained in some of the provisions. Specifically, we've been working on aspects of the employer mandate. If it were to go into effect, how to make it less burdensome. Folks are familiar with the quote from Nancy Pelosi that we'll have to pass the law to know what's in it, and I would contend that we won't know what's in it for a number of years until all of the regulations are passed that fully explain what's necessary to implement the law. In addition to our work in the regulatory space, we're also involved in the judicial proceedings. Although we're not we're not a party to any of the lawsuits, we've filed amicus briefs in support of neither party in the 11th, 4th, and D.C. circuits. And our amicus briefs have focused on the issue of severability. That means if the individual mandate is struck down as unconstitutional, what happens to the rest of the law? And we have asserted that if the individual mandate is struck down as unconstitutional, it's not the court's position, it's not the court's place to pick and choose which provisions stay and which provisions go. It should be remanded to permit further hearings and further testimony to explore the effects of repealing or of negating the individual mandate on the rest of the law. It's our belief that Congress intended for the insurance reforms to happen in a fully insured marketplace, and if the marketplace is not fully insured because the individual mandate is struck down, we believe that there will be significant ramifications for the remaining provisions. In fact, our policy position is that if the individual mandate is struck down, the whole law should be struck down. And although that is our policy position, that is not what we were able to argue in our amicus briefs. We couldn't quite go that far because as an amicus, it has to be neutral on the parties' assertions, and it can't come down in favor of either party. So we simply stated that it should not be left to the court to pick and choose which provisions remain. I hope that answers your questions, and we look forward to getting more questions from you in the future. Thanks.